Call Willie Rennie for 6 minutes, please.
Thank you, Deputy Presiding Officer. John Swinney and Murdo Fraser, I think, put their finger on it. It's about the balance, the competing issues, the competing factors that we need to consider when considering whether to have the lockdown measures we have or the ones that we might have in the future. Whilst we protect us from the virus with the lockdown, we are certainly causing harm with the lockdown as well. Delayed operations, man with his hip replacement that's causing him immense pain has been waiting a long time, operation cancelled. People with serious mental health problems, isolating at home. People on the autistic spectrum, people who are just frankly miserable that they can't see their family. All of these have costs to our well-being and our future. Putting aside the interests of the economy, all these factors compete against the factors that we're trying to deal with the virus. So this is really difficult. I mean, Liberal Democrats will use the best scientific consensus. There is no one single view. I'm a scientist myself. There is no one single approach to these issues. But there is a consensus from the best scientists. And we are prepared to support a different approach here in Scotland and within Scotland if necessary, if that science justifies it. We are prepared to do that, knowing it may compromise the unity and the clarity of the message and risk falling compliance as well across the United Kingdom. But for a different approach to be justified, there needs to be a significant difference in the scientific conclusions north and south of the border. To be honest, I'm not interested in who's causing this divergence, whether it's the UK government or the Scottish government. What I want to know is whether it's justified by the best science. We are putting a lot of confidence in the accuracy of the R number. Factors such as hospitalisation and the death rates help us since the virus incubation period is so long. Therefore, it is difficult to actually say that this is the R number now because the information we're basing it on is weeks old. The Imperial College London are doing randomised testing of 25,000 people. But will that be enough to pick up variations in different parts of the United Kingdom? The overall number of cases is important too, but since we are not testing many people in Scotland beyond the key workers, we don't really know what that number is either. Ministers believe the R number may be higher in Scotland, but they openly admit, and he's done it today, they openly admit that the margin of error is high. With all these uncertainties, I want to know whether it is possible to be so certain that a different approach in Scotland is justified, especially when it compromises the unity of the message which we've benefited from over the first few weeks of these measures. So, not just now. So will the Deputy First Minister agree to publish the evidence that he's got? We've had the benefit of having political unity across the chamber here, backing up what the government's doing. We've had the benefit of that same unity at Westminster. So I make the same plea to the Prime Minister. Let us see the evidence that you've got. Flaws and everything. I know none of these things are perfect. But if we are to have confidence and therefore to have political unity, we need to see as much as possible. This is a global pandemic, and therefore we all must stick together and do the right thing. The days of the old political potshots, I think, are gone. What we need to do is try to look to the evidence and work together. So trust us. Give us that evidence so that we can maintain the political unity, so that we can have the compliance to the message that we've benefited from over the last few weeks. The Prime Minister has set out his message and plan. Northern Ireland has done the same today. I think it is now, in detail, the requirement of the First Minister to do the same. So what is next after the stay-at-home message? The government has doubts about that slogan. I've got doubts about it as well. But are they ruling out adopting that slogan at some point in the future? I would like to know whether that is the case. If not, is the government in discussions with the Welsh and Northern Irish governments about a joint approach with them? I'm nervous about having two different approaches across the United Kingdom. Even more so about having 4 different approaches in the United Kingdom. It is frustrating that the communications between the UK Government and the Scottish Government seem to be so poor. I would have thought we would be able to improve the communications. Whosever fault it is, I would have thought in the middle of a global pandemic, we would be able to put those differences aside and have a greater communication between these 2 institutions. The Government has started the discussion about the next steps from the lockdown, but there is no route map or detail yet. We need to know when that will be published. The testing and the tracking capacity will be an important part of easing the lockdown. We need to know when that will be ready. Stay at home is the messaging for now, but we need to know more of the detail about what is going to come next. Let's have that open, mature, adult debate about those things. Now, there are other steps I think we need to take. The Chancellor's announcement today on the furlough is a step in the right direction and something that we were arguing for before. That extension and flexibility should be extended also to the self-employment schemes as well. There needs to be, I think, a universal basic income to fill in the holes in the various financial measures. We need to pay the frontline NHS and social care workers that supplement of £29 a day. The non-urgent treatment in hospitals and GPs should start again. People with mental health or on the autistic spectrum need extra support as well. There's much more that we should be doing through this pandemic, and we will work constructively, as we have done so far, with the Government to make that happen. This is a global pandemic. In order to defeat it, we must work together. Thank you.